As insurance adjusters in a managed care system, you need to know two things: what can be done for the patient and what will it cost. What can be done for the patient and what will it cost is also something that the doctors want to know, but they want to know something more: what works and what doesn't. Nobody wants unnecessary treatment. Nobody wants bad treatment. You don't want to waste your money. Caregivers can't afford to lose time. The answers to the what can be done and what works questions start with precise documentation. In hands-on care, such as chiropractors, physical therapists, and osteopaths provide, there is no way to know exactly what was done for a patient and what worked or what didn't work. Each professional does it and describes it differently. The hands-on caregiving works typically in one of two ways. First, the active approach, where the patient actively participates in the care by performing exercises under the supervision of the caregiving professional, for example, sports injury rehabilitation. Second, the passive approach, where the patient is inactive but passively receives a treatment from the doctor. Some examples might be deep muscle massage or chiropractic adjustments. Documentation, especially in passive treatment, varies from doctor to doctor. No standard exists. And over 90% of the documentation that might show what passive care was given or how it worked is completely non-existent in traditional classic soap notes. It's the wild, wild west out there. Why? Well, first of all, how does a doctor in a chiropractic care setting, for example, indicate on a chart exactly where he was in relation to a patient, how much pressure was applied, and exactly what vertebral bodies were affected? The doctor would have to be something of a graphics artist or a Nobel Prize-winning descriptive author to explain the treatments in every case. Now, with all that said, it's easy to understand why notes such as chiropractic techniques were performed or osteopathic manipulations were done on Mr. Jones today are the typical entries in a hands-on caregiver's chart. The direct, obvious result of all this is that there's no way for either you or the caregivers to ever really know what was done for a given patient and how well it worked. Other caregivers may see or treat the patient. They absolutely cannot recreate or know just what was done before. And certainly reviewing professionals, such as independent medical examiners, can't make any opinions on whether the treatments were warranted or not based on such general notations. You are left simply to pay for something that you have no way to document and no way to understand. Again, going back to the chiropractic caregiver for an example, let's review the possible treatments that a patient with a C5 specific blockage may receive depending solely upon the doctor involved. 1. Diversified adjustment technique given either sitting, standing, or lying down. 2. Activator percussion. Or 3. Cranial massage. There are many other therapies that might be used, but in any event, on the doctor's soap notes, whatever the choice was will simply be recorded as, quote, chiropractic techniques were performed, unquote. Outcome assessment, without knowing precisely what was done, absurd. The Dewberry method of documentation for the first time addresses this problem and allows the insurance company to perform good outcome assessments based on good documentation. This will ultimately weed out the ineffective procedures, saving time and money. Here's how it works. The Dewberry method allows caregivers to create technical charts specifically describing and numbering routine techniques. This is a once-only investment of about an hour of a caregiver's time. The chart's specific codification makes it universal and accessible to all doctors. The chart documents the standards of a doctor and the doctor's office. In daily soap notes, the doctor just enters the number of the technique performed on a given patient and sends it in as however you may require. This system saves over 15 minutes of writing for every soap note that the doctor records. And just by reading the chart, the chiropractor or osteopath can know the exact technique performed a year ago. Other doctors and associates can maintain a perfect continuity of treatment. With reliable standards, both patients and doctors are better able to avoid malpractice. Insurers and the caregiving professions can evaluate and regulate the quantity and the quality of care that's being paid for. This video presentation to you, the insurance adjuster, hopefully informs you of the current problems and gives you the arguments that you'll need to implement change. The unique Dewberry system raises chiropractic adjustments and osteopathic manipulations to professional standards. This method helps the doctor provide better service and is cost efficient. The doctor saves time, you save money.